The coronavirus pandemic has overshadowed just about every other health crisis. But there's another epidemic that hasn't gone away, and that's the opioid epidemic. And COVID changed how we treat that, too.
We realized that the virus was spreading and that we were going to need to take severe actions to try to control the spread of the virus, which meant that a lot of treatment programs were going to have to close.
Even before the pandemic, drug overdose deaths were rising again. Then by April of this year, more than 76,000 people died from an overdose in the previous 12 months, setting 2020 on track to be the worst year ever for overdose deaths. Combating addiction is already challenging. According to a Surgeon General's report from 2016, only 1 in 10 people with a substance use disorder get the treatment they need. And this year made it worse. The reason? Addiction treatment benefits from face-to-face interaction. So how do you treat addiction and social distance at the same time? The answer, telemedicine.
We started keeping track pretty early in January of this year of starting to hear about COVID. What was that going to mean for everyone in general, but also how we were going to conduct our patient care and be able to continue to provide that access, which has always had barriers from it anyway. The issues that often impact people suffering from substance use disorders is only exacerbated during this pandemic. We do definitely know that there is an increase in substance abuse since the pandemic started, and more overdoses are presenting to the emergency rooms.
When it comes to addiction treatment, how has COVID-19 impacted your business and your industry?
We switched from 100% face-to-face visits in our centers across the country to probably greater than 95% via telemed.
Before the pandemic, treatment was tightly regulated. That's because opioid addiction is treated with medications that are actually long-acting opioids.
There are safety risks should those medications not be monitored effectively. There's the possibility that those medications can get to individuals who should not have them. During a pandemic, we have really done all we can to allow clinicians to make decisions that would make the medication more available to patients to address their clinical needs. When we do that, we have to also monitor to make sure that communities are not seeing any negative effects, that these medications are staying with the individuals for whom they were intended.
Judging from your communications with local and state leaders, would you say that these loosenings of restrictions, has it been successful thus far? Has it gone well?
It has gone well. It's time for us to look at how we can make the care and treatment of opioid use disorder and other substance use disorders easy for individuals in terms of medical care, in terms of community supports, and something that we can know that we can do safely.
Experts and advocates say telemedicine is making treatment easier and more accessible.
Not only does it make it possible for more people to access care, but it reduces stigma. When you can do this by telehealth, you allow somebody the ability to build a relationship over a period of time that hopefully then makes the person feel more comfortable with coming to face-to-face care.
These changes are only in effect until our public health emergency is over. So with the COVID vaccine around the corner, access to treatment via telemedicine might not last forever. Right now, there's a bipartisan bill in the Senate that could make these changes permanent, the TREATS Act.
We have millions of Americans who need this kind of care, and it is very important that we make it as widely available as we possibly can, that we provide the best evidence-based care for people, and we know what that is.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.